a skin incision.
5 women are about to undergo a life-giving experience. It will also be life-altering.
It's a girl.
For some, it will be absolutely joyful. For others, it will be positively devastating.
Get down here now. They're gonna deliver. Just come.
But for all, it will be a very special delivery.
Okay, first one's gonna come out breech.
Of a brand new life. Unique and one of a kind. At Long Beach Memorial's high-risk unit,
What we're going to do, Trisha, is give you a shot to relax your uterus.
doctors are about to perform an unusual procedure on 43-year-old Trisha Van Bergen.
We want this thing to be as flexible as possible so we can get that baby to turn around.
She's 38 weeks pregnant with her 3rd child. 4 days ago, during a routine ultrasound, doctors made a disturbing discovery.
Unfortunately, the baby is in a breech position. Her head is up, where by now, at this gestational age, she should be head down. And the doctors need to push on my stomach and try to flip her around.
It's got its head up right now, and what we're going to do is try and do a forward roll. The whole idea is to get the uterus relaxed, turn the baby, and we'll be done in a few minutes. It either works or it doesn't work, pretty much just like that. Here we go. Can you see where the head is, Nori?
Using an ultrasound as a guide,
There you go.
doctors use all their strength to push Trisha's baby into position.
Hang in there, Trish, you're doing it. Head again, please.
If they fail, the result will be a breech delivery, where the smaller, more compressible body is easily delivered, but the larger head becomes trapped in the birth canal.
Blood supply would be cut off and potential brain damage, causing mental retardation and poor development.
Let's see it again.
But this procedure, called a breech aversion, can be life-threatening.
The complications are potentially a cord accident, where if the reason this baby chose to be breech is that it's entangled in its own cord, you may put undue stretch on the cord and tighten it and decrease blood flow.
Seems to be moving some.
Another complication, the placenta could literally tear away from the wall of the uterus. It's a condition called placental abruption. If that happens, Trisha could suffer uncontrollable bleeding, and her baby would die.
That would cut off the baby's blood supply from the mother. So both of those would be show by a decrease in fetal heart rate and would require immediate delivery by cesarean section.
It's an extremely painful procedure for Trisha.
It's over there in the corner, not bad. I think we should try one more push like we did, and that's the end of this. Whatever happens, happens. Ready? Let's go.
If they can't get the baby in position within 15 minutes, they'll quit and schedule a cesarean section. It's the only alternative.
Okay, let's see again.
Uh-huh.
Yay! Heartbeat, please. This is one of those magic things that when it works just like that. Way to go, Trish.
For now, the baby is in position.
Hey, compared to a cesarean section, this is fantastic.
If the baby stays head down, Trisha will be ready for delivery in 5 days. But if she flips, Trisha will have to have the surgery.
So we'll see you on the weekend then.
Oh, is that when you're delivering? Your mother has put in an order here. While we're at it, I don't like to work between midnight and 7.
Leslie Tvaris has been here in this room on bed rest for 6 weeks. Because she's expecting twins who need round-the-clock monitoring.
The monitors monitor the baby's heart rate, so if they change at all, they'll be able to act quick
quickly.
Because there is no sac separation between the babies, the twins free float around each other with 2 umbilical cords. This can be deadly. It's a condition unique to these types of twins.
Monoamniotic twins are twins that are in the same sac, and there's a 50-50 mortality rate with them because of cord entanglement.
With the extremely high probability of mortality, Momo twins can't be delivered vaginally. Today, Leslie is having an amniocentesis to find out if the baby's lungs are developed. But during the preceding ultrasound, doctors learned that one of Leslie's babies is not doing well. His heart rate is soaring.
These babies have stayed literally 140s, 150s the whole time, and all of a sudden baby A has jumped up to the 200s. It's a cause for concern because it's a change and it's out of the range of normal. Probably we're going to go ahead and deliver you. Okay. And we don't need to do an amniocentesis or anything.
Can I call Matt?
Sure. Why don't you go ahead and do that?
Doctors don't want to wait. Leslie needs to have an emergency C-section now.
Get down here now. They're gonna deliver. Just come. Okay, bye.
Lakeisha Stoner is 26 weeks pregnant. Yesterday, she was admitted to the hospital after an abnormal ultrasound reading.
They noticed on the ultrasound reading that the baby's the umbilical cord was flowing intermittently, and at some periods there was no blood flow to the baby at all,
which has seriously affected the growth of her fetus.
The baby is about the size of a baby would be at 23 weeks.
Doctors think the reason for the slow growth rate is Lakeisha's chronic high blood pressure, which has resulted in pregnancy-induced hypertension. The baby's blood flow is decreased, and it doesn't get the proper nutrients.
Due to decreased blood flow, the baby doesn't get proper oxygenation and also doesn't get proper nutrients, which means the baby basically doesn't have the essential things like amino acids and things that it needs to grow in a normal fashion.
They're gonna do another ultrasound scan probably tomorrow or day after tomorrow to check the blood flow again. And based on that, they're gonna let me know whether or not the environment that the baby is in is okay for her to stay in for a little while, or if they're gonna have to deliver.
Good morning, Ms. Stoner. How are you?
Morning.
Dr. Fortson here. How are you doing this morning?
Okay.
We're going to give the baby the steroids to help the baby's lungs mature.
At 26 weeks, this baby is barely viable. If she survives the delivery, she'll be on life support for weeks. And even then, there's a good chance she will suffer long-term respiratory disease, heart problems, and brain damage. But doctors are particularly worried about Lakeisha.
Okay, if you should have any sort of symptoms, any headaches or anything like that, blurred vision, epigastric pain, any pain in this area, make sure you call us right away so we can come see you.
If Lakeisha's blood pressure spikes, she could have a stroke or a seizure. She could die.
We're basically going to watch you on the monitor and try to buy as much time as we can at this point.
Can you tell me your birthday?
7/27/59.
Roseanne Uwe is at full term.
You know your blood type?
O positive.
Today, she will be delivering her third child.
When was the last time you ate?
About 8:30 last night.
Okay, no sugar.
Normally, this would be considered a routine procedure. But in Roseanne's case, it's not.
How come we're having C-section? You had it before?
My second one was a C-section, placenta previa.
Because of her age of 44, she has an increased risk of having a baby with a chromosomal abnormality.
Roseanne has been trying to get pregnant with this child for 12 years. In the past 2 years, she's had 2 miscarriages. During this pregnancy, despite her age, she told her doctor not to do an amniocentesis.
She chose not to have an amnio because she is not going to do anything with the information. You know, she looks at this as a blessing, and she'll take whatever she's given. No matter what's given, it's fine, it's a blessing.
And this is a metal, right?
Yeah, I can't take it.
Yeah, you can have it when...
But it's risky. At the age of 40, the odds of having a baby with Down syndrome is about 1 in 100. At the age of 45, it becomes about 1 in 25.
We don't know the genetic makeup of the baby, but you know, we obviously have looked at the baby with non-invasive techniques, ultrasound and what have you, and so the baby looks perfectly normal. But you're right, you know, we don't really know until the baby is born.
Go have some babies.
Okay, yeah.
After being on hospital bed rest for 6 weeks, 29-year-old Leslie Tvaris is rushed into emergency surgery to deliver her Momo twins.
It's like, let's just do it and get it over with. 6 weeks is long enough.
Okay, just some oxygen here. Lift your head.
One of her twins, who shares an amniotic sac with his brother, has a dangerously high heart rate. The babies need to be delivered immediately.
Dad, okay, you're here? Knife, please. Thank you. Ready? Okay. Okay, skin incision. We're just getting through the skin incision and the fascia, and we're trying to now get into the peritoneal cavity. So. Okay, here comes Matthew. So he's blowing bubbles already. Hey, dude.
Hello.
Hey, little guy.
Oh, so cute.
I know. Look at typical firstborn, making noise already, huh? You bet. You got him?
Matthew weighs in at 4 pounds, 4 ounces.
All right, here comes his brother. Now, Daniel is wearing the cord around his neck several times.
Although Daniel's cord is wrapped around his neck, doctors are more concerned about the intertwined cords.
Here's Daniel, okay. Say hi. Sometimes in these monoamniotic twins, you can actually see the cord knotted several times over it, and you'll get, like, you can see that one false move and it gets cinched, and then boom, the blood flow stops and then disaster occurs.
Daniel is slightly smaller, 4 pounds, 2 ounces.
Are they okay?
Barely 5 minutes out of the womb, the Tvaris twins are already having major difficulty breathing. In the next 72 hours, these babies will challenge veteran neonatal staffers who are fighting to keep the boys alive. Barely 30 minutes old, the Tvaris twins are already concerning staffers in the NICU. An X-ray showed that Matthew's premature lungs had resulted in severe respiratory distress syndrome. Doctors had to place a tube in his trachea and connect it to a ventilator.
After we started the ventilator, we started improving, and we're doing much better.
Daniel was also placed on a ventilator.
He would stop breathing for some time, and then when you would really stimulate him, move his feet and all that, he would start breathing, but then stop again. Both of your babies are doing much better now. We'll just have to wait and watch and pray and see how it goes.
Okay, good.
All right?
For Leslie and Ray Tvaris, it's encouraging news. But in the NICU, good news can turn in a heartbeat.
Put on this one.
21-year-old Jamie Johnston is 36 weeks pregnant.
My sister's having twins. It's the first set of twins in our family, and her first boy. She's having 2 boys. So we're really excited to be here.
Jamie isn't supposed to be here for another month. But today, that changed.
When the nurse checked her, she was dilated to 4. So we went in to do the ultrasound, and the babies were transverse. So she called the doctor, and the doctor said, "Get over here."
Linda's gonna hold you, okay?
Transverse twins are linked side by side. Neither is head down. So vaginal birth is out of the question.
Twin A, which is the first one, is laying with the head to mom's right, and twin B is laying with the head to mom's left.
So far, Jamie's doing fine. But at 4 centimeters, her water could break at any time. That's where the danger lies.
If you think of my finger being the umbilical cord, and if it falls out through the cervix, and if the baby then comes down and puts pressure on that, it in effect will shut it off, so there will be no more oxygenation coming to the baby. And unless you could get the baby delivering relatively expeditiously at that time, the chances that that baby surviving would be very remote.
Doctors think this will be a relatively routine C-section, but in the high-risk unit, nothing is ever routine. Lakeisha Stoner has been on bed rest because any activity will increase her already high blood pressure. Unfortunately, last night her blood pressure spiked considerably, reaching highs of 160 over 100.
Today, the doctor came in and told me that due to my hike in blood pressure last night and it's not stabilizing, it's not going down, they want to go ahead and deliver me today.
Doctors have no choice but to deliver her baby prematurely. She's barely 26 weeks.
I kind of expected it. I've been expecting it for a while. I don't know, I guess in the back of my mind, because I've been having problems through this whole pregnancy. So it's not really a shock to me. Things happen, and I figured that if something like this would happen, you know, kind of last minute.
You can see your knuckles.
Although babies are considered viable at 24 weeks, Lakeisha's baby will face more than her share of life's challenges.
Looking for the hand now?
Her growth lags behind by almost 3 weeks.
You can see her belly moving. She gets points for that. That means she's a fighter, right? Yeah. She'll be active afterwards, too. She gets all her points for this test. Yeah, I mean, this test has been reassuring. It's kind of hard to say at this point. Her blood pressure has been really high, and we're trying to determine if the environment inside the uterus is going to be harder for the baby than the environment outside of the uterus. So I think at this point it's probably safer for her little one to come meet us.
Bye-bye. I'm praying for you. Everything gonna be okay.
At 3:30 p.m., Lakeisha is wheeled to the OR. She's hopeful. Doctors are realistic.
This baby, you know, is 26 and 4/7 weeks by her last menstrual period, but based on ultrasound, it's measuring 18 days smaller, which really puts it to be at risk and really can compromise its status once it's delivered.
Welcome to the operating room, where the happy, friendly nurses are.
Although the atmosphere is jovial, it's also incredibly tense. There is so much at stake here that doctors have asked us to leave the OR.
I'm expecting that the C-section itself will go smoothly. It's just a matter of the resuscitation of her baby after.
At this level of prematurity, Lakeisha's baby has only a 40% chance of survival. It's been 5 days since her breech aversion. Today, Trisha and her husband, Ralph, will find out if their baby has hopefully remained head down.
Patricia was saying that kind of felt like the baby was turning around, so she was kind of concerned with that.
It's 7 a.m., and Trisha is being given Pitocin to start contractions. She's also been given penicillin because she tested positive for group beta strep.
We need to treat her because if her baby contracts that during delivery, her baby can get very sick from it. So it's just something that it doesn't harm the mom whatsoever, but it has a potential to harm the baby. I'm Janice. I'm going to take care of you. Your baby.
Trisha needs to start contracting as soon as possible, or the baby could go back into a breech position.
And once you start having contractions, your uterus generally keeps the baby in the same position that she's in, so the baby doesn't have a potential of flipping during labor. Let me just monitor your baby for about 10 minutes now. It's been off the monitor for a few minutes here. Get a good strip of the baby, and then I'll let you get up and move around. She's 3 centimeters this morning. I have not re-examined her. She's not really aware of any contractions yet. And we're going to get her up and walk her in a few minutes.
Okay, start tissue.
Jamie Johnston's transverse twins are about to be delivered.
Can you hold that one down real good there, Aaron?
Do we have a wet towel?
Well, what we saw in ultrasound has just been proven right.
Andrew James Johnston weighs 5 pounds, 5 ounces.
Okay, take a quick look here at this little guy, huh? Maybe he'll pee on you or something.
Andrew's delivery was easy, but his brother's is not. Because of his transverse position, his head is over to his mom's upper right. Doctors are having a hard time reaching in and grabbing him. And right now, he's stuck.
Bag is really tight. Is that a foot? Yeah. Go ahead and come back here. Slippery little feet. Bag is really tight. And then those little kicking is right. Leave me alone. Okay, now let's get this bag broken.
Precious seconds have passed since Jamie Johnston's first baby was successfully delivered.
Get it right there.
But his twin is stuck high up in his mother's uterus. Doctors work frantically to pry him loose from this uncompromising position.
And the membranes were real tight, so it was hard to hold on. It just kept slipping away. Just saying, I like it here. Leave me alone. It just took a while to get a hang of the feet so we could break the water and then deliver the baby basically with a breech extraction.
Anthony Brian Johnston is bigger than his brother, weighing 6 pounds, 3 ounces.
Here's the other little guy. Okay. Come on. Let's get you over there.
What a relief to know that they're all right. That's the main thing.
But he's having a little more trouble on the outside.
I usually catch it all.
Jamie finally gets a glimpse of Andrew.
Gorgeous.
Right next to Mom. Smaller of the two.
Isn't he darling? Do you see him?
Very
Oh,
feisty.
he is darling.
Very right, you can.
Oh, you're stretching. You finally got some room.
Yeah, there you go.
The family is briefly joined by Anthony.
There you go. Take a little more. If I have to. Right here, yeah.
Just B or
B.
B, yeah. Little feet didn't want to let me get a hold of it. Kind of pink up, huh?
So we're just going to take the baby over just to have a look and make sure everything's okay. Just because the color is not so great, make sure the baby's breathing okay and everything's fine. If everything's fine, then you can probably go back to the newborn.
While his older brother goes to the transitional newborn nursery, Anthony is too unstable. He is taken to the NICU.
He wasn't crying very much, so his lungs weren't really working as strongly as they should. Coloring was not very good. He was rather purple. When we found out that he was going to go to the NICU, it broke my heart.
But before long, Anthony is joined by brother Andrew, who begins to show signs of instability.
They moved in there because his oxygen sat was falling really low. And I guess he wasn't keeping it up on his own without the oxygen, so it's scary.
With her husband Adrian at her side, Lakeisha Stoner's C-section is over. But her baby's battle has just begun. Born severely premature, tiny Kennedy Stoner can't even take her first breath on her own. She is intubated in the OR and rushed to the NICU.
She was brought over here and we put her on the ventilator. The doctors then put umbilical lines in her. Kennedy weighs 1 pound, 3.5 ounces, and she is 11.5 inches long, and that is small for a 26-weeker.
Just minutes old, she already has an overabundance of medical problems.
The chest x-ray did show hyaline membrane disease, which just means that her lungs are premature. We suctioned down her ET tube, and we had frank blood come out of her ET tube, which is called a pulmonary hemorrhage.
But this is just the beginning of Kennedy's fight for life. The next few days are going to be an emotional roller coaster for both parents and baby.
There's no way to guess the odds for survival rate, but we always do tell parents that the first 24 hours is the most critical. And we also tell them that with a 26-weeker, that you just want to take each day, day by day.
She has a modified. It's good that she weighs 1 pound and 3 ounces.
Lakeisha isn't out of the woods either. Even after delivery, her blood pressure is high. Doctors are worried.
I think today pretty much proved what we thought, that she had hypertension plus preeclampsia, which is a very dangerous combination. So in the next 24 hours, she'll be on magnesium, which is a seizure prophylaxis, and we'll just keep a close eye on her.
Today, Leslie will visit her twins. She has to make 2 stops. Daniel's in the NICU, while Matthew, who is more stable, is in the step-down intensive care nursery.
He doesn't have the tube in his mouth anymore. I know.
In the past 24 hours, Daniel overcame the first obstacle of being a preemie. He's no longer on a ventilator.
He's got all his toes.
Yeah, I see that.
He looks good. You look good, buddy.
Doctors are confident that Daniel won't be in the high-risk intensive care unit much longer.
You're doing good.
So he'll probably be going over to join his brother pretty soon.
He will.
Yeah, he's doing really well. He's the next baby to go out of this room.
Oh, okay.
So don't be surprised if you come to the spot and
he's gone.
He's with his brother.
So cute. Hey, buddy. You get to go hang out with your brother. That is crazy. Huh?
Matthew's breathing tube has also been removed.
He's still breathing a little fast, but he just needs to get used to it. But his blood pressure is still low, so we're giving some more volume.
Okay. Will I be able to hold him today?
I don't think so, just because he's still breathing a little fast and his blood pressure's low.
Okay.
So if everything's fine tomorrow, he's able to keep his blood pressure up without any help, medication-wise.
Okay.
And he's not breathing as fast.
Okay.
Then
Okay.
we'll be able to hold him.
Okay, great.
You want to make sure that they're stable, breathing, blood pressure, everything before we take them out. Because sometimes holding is stressful for premature babies.
It's hard touching him and not being able to pick him up and hold him, so hopefully tomorrow I'll get to hold him. That's probably one of the hardest things, is not being able to hold your baby. You're doing good. You're doing good. Keep it up.
Pull towards your right and straighten out. There you go.
It's slow going for Trisha Van Bergen.
I'm going to just feel your cervix and see, maybe we can break your water bag here.
This will increase dilations and drop the baby lower and into the birth canal.
Can you hold the baby about?
But Trisha needs to be dilated more than 3.5 centimeters.
All I see so far is just mucus from the cervix. I don't think we're going to aggravate you anymore. We'll just wait on it. When the contractions push the baby down closer, then we'll be able to do that. Or you may actually do it spontaneously.
To speed up her labor, Trisha and her sister Lily walk the halls.
I thought by now the contractions would have been stronger in a more regular pattern and that I'd be more dilated, but she's taking her time making her way into the world.
What I'm doing is just feeling to see if your cervix has changed.
Okay.
3 hours after starting Pitocin, Trisha is at 5 centimeters. She is ready to have her water bag broken.
I'm going to try again. I have a little hook here, just kind of snag the membranes, which are quite thin, like a piece of saran wrap. There we go. That was it. The fluid is clear.
Great. Good.
And you're going to feel,
I feel the rush. I feel the rush.
I feel
With her water broken, Trisha's baby is well on her way. Fortunately, she's still head down, but she's about to throw her mother another curve.
Going to the NICU to see my baby for the first time.
It's been a tense 24 hours for Kennedy Stoner.
She's stable. We have had blood pressure problems though, so we have started her on now 2 drips, dopamine and dobutamine, to help with her blood pressure. And with those 2 drugs, her blood pressure has been stable.
She is so tiny. She looks fake. Like a toy. I didn't even realize she was this small.
Kennedy's body is vibrating because of her breathing machine. It's a high-frequency ventilator which works by diffusing air into the airways and eliminating carbon dioxide.
No, she can't feed at all at this point, right?
She's still too sick.
Okay.
We'll start her off very, very slow.
Okay.
The good news is Kennedy's chest x-rays show that her lungs are improving. But during a heart ultrasound, doctors have discovered a problem.
It's a valve in her heart that with a newborn baby usually closes, but prematures, a lot of times it doesn't close, and we have to start her on a medication called Indocin.
An open valve weakens the oxygenation process and can result in a congenital heart defect. If the medicine doesn't work, Kennedy will have to undergo surgery to close the valve. But she's too unstable to survive the procedure. By tomorrow, doctors will know if she has made it past this hurdle.
I feel a lot better now that I've seen her and see that she's doing okay. She's super tiny, but but she looks like she's doing okay. She's a little fighter. So yeah, I'm happy. Be looking forward to holding her. That's the next step. Kind of scared to hold her now, though. So tiny.
The Johnston twins are barely 24 hours old.
They're doing okay. They're just giving them some oxygen and keeping a close eye on them.
Anthony, who started life in the NICU, is doing better than his brother.
He's actually receiving less oxygen than Andrew at this point.
Andrew, the oldest, couldn't handle life in the transitional newborn nursery.
We had a little bit of a color change and had a DSAP, which means he was not getting enough oxygen. So at that point, they decided we're going to go ahead and admit him to the NICU.
Nice toast.
Both babies are also being bottle fed.
Andrew was started at 5, and then Anthony's nipple feed was at 6.
Right now, the Johnston family is feeling secure. But in the next 72 hours, their world will be turned upside down.
Looks pretty good, Roseanne. Healed up really well from the last time.
The last time Rose Ann Uwe had a C-section was 11 years ago.
Nail scissors, please. The fluid looks clear.
Since then, she has had 3 miscarriages, 2 in the past 2 years alone.
Just clean your face off so we can really see you. All right.
Now, at the advanced age of 44, Rose Ann is about to meet her 3rd child.
Here it comes. Nice and gentle. Here we go.
She has no idea if the baby is a boy or a girl.
Oh, there we go. Oh, cute. Is it a boy or girl? Oh, it's a girl. That's right, we didn't know this before, did we? Baby's cute. Take a picture. Looks good. Nice and pink.
Because of her devout faith, Rose Ann refused testing to see if the baby had any chromosomal deficiencies. Doctors don't know yet if baby Rose Kathleen Uwe dodged a genetic bullet, but Rose Ann is simply happy that she made it into the world.
I'm crazy enough at 44 to have a baby. Normal, healthy baby. Thank you. That's all I ask.
Hello, congratulations. There she is in there.
Baby.
Well, you can see the tears in her eyes when the baby was born and she saw the baby, and the baby looks absolutely perfect.
Rose Kathleen weighs 7 pounds 2 ounces and appears to be healthy. It's a bittersweet moment for Leslie Tvaris. After being confined to a hospital bed for 6 weeks, she finally gets to go home. But she's going home empty-handed.
We're getting ready to go say goodbye to the boys because we're going home, but they're not. So.
The babies won't be going home for several weeks.
It could be 2 to 3 weeks, or it could be 4 to 6 weeks. So it just depends on how they progress. So, but they're doing good, so it's just hard leaving them.
Okay, buddy.
Daniel is the healthier one right now. He's already being fed through a feeding tube. But because of his premature status, he's developed jaundice and has to spend his time under phototherapy lights.
Hey, Mommy, I'll see you tomorrow. Keep your IV in, all right?
Matthew suffered from some unstable blood pressure, which could be causing a slight heart murmur. Doctors have put him on medication and ordered a chest x-ray.
Bye, Matthew. Okay, let's go.
Leslie will be back tomorrow, and the next day, and the next.
One of the nurses said figure on 4 to 6 weeks before they come home. It's not going to be good, but you know, we're doing what we have to do to make sure we have healthy children.
We noticed he was having increased work of breathing, so we did it.
Over there.
Yeah, over in room 280.
At 4 in the morning, Anthony Johnston has a major setback.
They told me that air escaped from his lungs and was trapped between like the sac and the lung.
It's a condition called pneumothorax. It's an air leak from the lungs into the surrounding chest space. This results in a collapsed lung.
They had to put a big needle in his chest and suck out the air.
In order to not tire him out, Anthony was immediately taken off formula and put on an IV. Doctors decided to do the same with Andrew.
They didn't want the same thing to happen to him because he's the littler baby, so they put him on strictly IV also.
Doctors will do another chest x-ray. Till then, Jamie holds a vigil by his side.
Another one.
Trisha Van Bergen is slowly dilating, and there's a problem.
So actually we went from 5 and 80 to 6 and 90 in about half an hour.
Still posterior.
Oh, really?
Although her baby hasn't flipped back into a breech position, she has rotated.
The infant was looking up when mom lays on her back. The hard head is in mom's spine, which is not the ideal way to deliver, and it makes it a little tighter. What I'd like you to do, Trish, is lean over this table like this and do pelvic rocks. You know what those are? And kind of tuck it in and then stick it back out again.
So we're kind of stuck right now and moving at a slow pace. If we can get that baby to rotate her head around, she'll move a lot quicker during her labor.
My legs.
Facing up, this baby is not able to help with the process, and Trisha will have to do all the work. For now, mother and child are in a holding pattern.
I see her at least four times a day. It's gonna be hard when I go home, though.
Today, Kennedy Stoner's parents received some good news.
The medicine should work, and everything seems to be going okay so far.
From what I got in report is normal now. So, and that was the one done earlier this morning.
The heart valve has closed. She won't require surgery. More good news. Her blood pressure has stabilized. But now another test for a critical condition that affects a high percentage of premature babies.
Tonight we're getting a head ultrasound to look at her head. Often premature babies have bleeds in their brain, so we're monitoring to make sure she doesn't have one.
The vessels in Kennedy's developing brain are fragile and bleed easily. With the ultrasound, doctors are looking for collections of blood in the brain. It's a condition that could lead to a neonatal aneurysm, brain damage, or death. The results won't be available until tomorrow. Two days after suffering a life-threatening lung collapse, Anthony Johnston is doing just fine.
I am feeding little Anthony Johnston. We just started him on feeds again today.
Anthony's pneumothorax was quickly controlled with a needle insertion to suck the air out.
So he's going in the right direction now. He had a little setback, but that does happen. And now he's doing good.
Meanwhile, his brother Andrew is still on antibiotics and is taking his meals through a tube. He's also under phototherapy lights for jaundice. But for a 36-week preemie, it's encouraging.
We're just increasing his feedings every 3 hours, gradually, and then we'll be turning his IV fluid down and just treating him with the antibiotics. And as soon as he can start nipple feeding and nipple all of his feedings, he can go home if he's like 4 to 4.5 pounds, and he will be, so.
Jamie was released 3 days ago, but she spends all her waking moments with her babies.
Mom is back.
I think I live here because I'm never leaving. Because I could be there 24/7. I'm gonna stay here like I was just living here.
Love you, buddy.
Because when your contraction comes, what I want you to do is take a big breath, hold it, and push down for 10.
Trisha Van Bergen's baby has finally jostled free from his stuck position and is ready to come out.
Get a big breath in, hang on, and push it. 1, 2, 3.
In order not to slow down her labor, Trisha declined an epidural. She's delivering this baby naturally.
I would say pushing the baby out was not that painful. It was her ascending down into the birth canal and getting ready in position was the most painful for me, where it's like, I wanted drugs.
9, 10. Get a big breath. Do it again. Go for 10.
Chest.
1, 2. Here's your baby coming.
3, 4. With the doctor's help, Trisha's baby is rotating head down, face down.
Ease off just a little. Ease off.
Do it. Do it. Look here, Trish. One baby girl.
For a near-perfect special delivery, Jenna Maria Van Bergen, 7 pounds, 12 ounces.
I'm glad you're out, little baby.
Good job. Good job.
Today, Adrian and Lakeisha say goodbye to Kennedy.
Kennedy. Your mommy loves you.
Kennedy is improving by the minute.
Wake up.
She looked good. She was sleeping. I was hoping that she would open her eyes for me before I left. But she was soundly asleep.
But her parents still haven't gotten the results of her head ultrasound.
It's strange. It's very strange leaving the hospital right now without the baby. So, I don't know, it's much different than my first experience as a new mother.
For at least the next 3 months, Long Beach Memorial Hospital will become Lakeisha and Adrian's home away from home. The news is good. Despite her mother's advanced age, Rose Kathleen was born without Down syndrome.
Okay, we're gonna take the baby to the mom.
However, Rose did end up with a bout of jaundice, so she's spending time under phototherapy lights.
Jaundice is from an immature liver that the baby has. How you get rid of it is just by feeding a lot, like breastfeeding is really good for the baby because jaundice is excreted by the stool. So that's how you get rid of it, and the lights also.
Because of the jaundice, she won't be able to go home for another couple of days. But today is special. She gets to meet her older brother and sister.
Okay, first of all, I'm gonna check ID bands and make sure that they match. Are you gonna be breastfeeding?
Bottle feeding for now. I thought she was very pretty. Yeah, I am ready to babysit. I babysat my little cousin before, but I finally get to babysit a little sister.
And already, Rose's older brother and sister are divvying up the chores.
My sister said if it's a boy, you have to change your diapers and take care of it. And I said, well, it's the same thing for you if it's a girl. I guess she has to change the diapers.
Yeah. To change diapers and feed the baby, that's his dream come true.
How's my big girl? You want to see your baby sister?
For Trisha, this baby is more than a special delivery. Every day, she will remind her mom of someone equally special.
We picked Jenna because we like to call her Jen for short. And Maria was my oldest sister's name. She passed away of ovarian cancer. And so we hope that she can be as strong as her.
And today, Trisha leaves Long Beach Memorial's Labor and Delivery Unit for the last time.
This will be our last baby. Our family was still missing one more link, and I think we got the final link now.
Take a picture. Got it?
For these moms and dads, their fears have been conquered, and their prayers have been answered with special deliveries that are truly one of a kind.